Welcome, everybody, to the Cone of Shame Veterinary Podcast. I am your host, DrAndyRoark. Guys, I am here today with my good friend, Ron Sosa. Ron is a Certified Vet Practice Manager and an educator and advocate on neurodiversity in veterinary medicine. And I give him kind of hard question, I think. I talked to him about wanting to support neurodivergent team members and also being honest about the workload that we have in practices and the fact that people in practice might not even know this person is neurodivergent and can get frustrated with behaviors or struggles that they don't understand. How do we do those two things? How do we support and also manage the individual and the rest of the team as far as their expectations so that everybody gets along and feels good and the work that we have gets done? And so anyway, we get pretty deep into some of the management struggles around neurodiversity, and Ron is fantastic. And so anyway, it's just great conversation. Ron is so wonderful and positive and helpful, and just, I feel like I took a lot away from this episode. I hope you will too. Let's get into it.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Cone of Shame with Dr. DrAndyRoark.
Welcome to the podcast, Ron Sosa. How are you, my friend?
I'm good. How are you, Andy?
Man, I am really good. For those who don't know you, you are the executive director of the Uncharted Veterinary Conference. You are a certified veterinary practice manager, and your career has taken an interesting turn in the last year or two because you've been doing a lot of writing on neurodivergence and neurodiversity in veterinary medicine. And you write about it from a management perspective, which of course aligns with the Uncharted focus of running smooth teams and practices. And it's just been really fascinating to watch you grow. You're doing workshops in this space and things like that. And so yours has been a career that I just creatively has really blossomed. And I'm just glad, you know, as the founder of Uncharted to get to watch it up close. But I've got something that I've been kind of rolling around, and I thought that you were the perfect person to talk to about it. And so let me set the stage and then kind of bring you in here. So, you know, I read a lot about running effective teams in vet medicine. It's something I care a lot about. And, you know, for a long time, I've taught SMART goals as a tool in our toolbox. For those who aren't familiar with SMART goals, it's just making goals that are specific, measurable, achievable, relevant, and time bound, meaning they have a deadline on them. And so it's a good way to sort of format your thoughts and make a structured goal that you can then check yourself against and make sure you're actually doing what you intended to do and that you're moving forward in the way that you set out to move. And so anyway, that's sort of something that I've talked about for years and kind of had it and used it. And then I saw a post from one of my friends. So Dr. Kate Boatwright she's writing a lot these days as well. And I think she's pretty smart. I do enjoy her. She's been on the podcast before. And so she had this post recently about the fact that she had been teaching SMART goals and someone really pushed back against her and said, boy, I hate SMART goals. And she said, SMART goals, the way it was put to her was SMART goals don't often work or don't tend to work for people who are neurodiverse. They just, the format doesn't make sense to them. And there are better ways to format information and work with people who are neurodiverse. I know neurodiverse is a big bucket. But really, it was interesting to see this strong pushback against sort of a format that seemed pretty sort of common sense to me at this point. And so I was thinking about that, and I was thinking back to something that you wrote recently about time blindness. And you talked about people who are neurodivergent in some instances might struggle with deadlines and just being sort of time unaware. And I thought, I would like to know more about this. And so I've talked a lot here, sort of setting up the reason that we're sort of talking. Ron, let me kind of hand this over to you. Can you talk to me a little bit about, let's say to start at a high level, as a CVPM, as someone who is focused on efficiency and operations, and someone who is really interested in being supportive of neurodivergence in our practices, can you talk to me a little bit about the challenges that neurodivergent people face from an operations standpoint in practice?
Yeah, I think the number one thing that gets spotted probably the most is just what you said. We talk about time blindness. And time blindness is basically the inability to tell how long things take, what time of day it is, how long you've been spending. Like, think about our exam room common problems where you send a technician in and they've taken 30 minutes of the appointment getting a history. any one of us can experience time blindness. So it's like, I didn't even realize it was in there. Or think about the time you drove home from work and had no idea how you got home. It was that autopilot moment, right? That is time blindness, where our mind goes on the auto drive. We have no idea a sense of time, how long things are taking, how long things are not taking. We're just doing the thing right in front of us.
It's to me, I always look at that as kind of a good thing in practice, right? It means you're fully engaged with what you're doing. Okay. So if I'm working on a team with someone who's neurodiverse, how often is things like time blindness, how does that come into play? Is this someone who is constantly unaware of time, or like, what does that look like in day-to-day practice and how I'm working with this person?
Yeah, I would say that, the neurotypical person, it probably happens to, a few times a month maybe, but for the neurodivergent person, we've got to be really, really careful. And so I would say that being somebody who was late diagnosed, didn't really understand myself, I would say I have been torn to the other side, where I've been extremely overly conscious of my time. And so when I'm in an exam room, I'm going to get in and get out and getting a history. But for others, they may not recognize how much 10 minutes is or 5 minutes that you allot for that. And so it happens all of the time. They have no idea how long they've been shooting an x-ray for, or taking care of a treatment on a pet, or, educating a client. They have no concept of what 10 minutes feels like, because 10 minutes will feel like an eternity in one moment, and it also feel like 2 seconds have gone by in another moment. So there's no consistency of what it feels like.
I think a lot of people probably feel a little bit, a little bit torn or a little bit trapped when we start talking about colleagues with neurodivergence, because we have a very compassionate profession. Yeah. And I want to be compassionate, and I want to set people up to succeed. And at the same time, nobody wants to be buried under work and not having appointments get seen and things like that. Hey guys, communication is key to creating amazing experiences in the clinic. From the phones to the front desk to the exam room, the way our teams interact with pet owners makes a difference. The team training bundle I have at DrAndyRoark.com brings together my Charming the Angry Client and Exam Room Communication Toolkit courses to provide flexible, on-demand communication training for your veterinary practice. Check them out. These courses are made to be taken in groups. They have discussion questions. They are all about taking these trainings and getting them to apply to your practice, your culture, and your clients, whether it's handling angry clients or being effective in the exam room. We've got some great training resources that you can grab and drop and use pieces of. They're all broken up into 5-minute modules to make it super easy for you to use what you want and skip over what you don't want. Tag them on to the end of staff meetings, or just make a whole staff meeting out of the trainings. Anyway, super flexible. It's DrAndyRoark.com/team training. Gang, let's get back into this episode. And so it's funny when I look at this post about SMART goals, and my friend is getting this pushback that says, this doesn't work, this doesn't help. And then I see things about like time blindness, and I go, okay, I see that, and I want to be compassionate. And also, I don't know how we run an effective team if we can't pay attention to time or set, actionable goals and hold people accountable. And also, I would never want to have a profession that wasn't open to everyone. And there are, neurodivergent people that we work with who've been absolutely wonderful to be around. And so let me sort of give you that little bit of conundrum, because I know it's something that you think about and write about a lot. Is, Ron, start to unpack for me a little bit about what it looks like to provide a supportive environment and to be open and, welcoming of neurodivergent people in our teams, and also not have the rest of the staff get frustrated because we say, well, this person, we've told them what the goal is and they don't work to it, or we've told them what our constraints are and they're not being met. How do you manage those things?
Yeah, I think first we've got to recognize the fact that we've built society around the average brain chemistry, right? So when we think about, we're frustrated because somebody hasn't achieved their goals, it's because we're being very rigid and not thoughtful about how different brain chemistries work. And so, I think about the SMART goal, and there's something called a demand avoidance. So once you tell me I have to do a thing, it is much harder for me to want to do the thing. Whereas if I was already going to do it and I was already committed myself to doing the thing, I can easily get it done. Also with ADHD, you have it's either now or not now. And so I'm either going to do it right this moment, or I'm going to forget about it until the deadline comes, and I'm going to do it in the last 10 minutes. And so I think that's part of the issue with SMART goals is it does not necessarily allow for the follow-up needed or consistency of follow-up needed or the understanding of sensory needs that would preclude from being able to achieve the SMART goal.
Talk to me more about sensory needs to achieve a SMART goal. What do you mean when you say that?
Yeah. So sensory, obviously we have our 5 senses. We've got sight, smell, taste, touch, and hearing. And so with neurodivergent individuals, we have a heightened or desensitized sensory system. And so, fluorescent lighting, I think affects most of us, but think about that lighting situation, how that flickering fluorescent bulb would bother the normal person. Now times that by 10 or 100, and that's overly affecting that person. And so if I have a sensory hypersensitivity, like this, some people have a hypersensitivity to a certain smell, or I always equate this with allergies. When you talk about the allergy pet who has a threshold, right? They're allergic to trees, grasses, molds, weeds, and something tips them over the edge and they have an allergy flare up, right? So they could be allergic to 10 things, but that 11th thing pushes them over the edge. That's how I think of sensory. Like we can be fine with some of our sensory inputs until you hit that 11th thing and then it completely pours over and you get breakdowns, you get emotional dysregulation, you get the inability to effectively do a task. You get all of that just kind of breakdown, and shame kind of sets in because you can't do the thing.
Do you think that usually presents in a way that people recognize it and say, oh, well, this is sort of sensory overload? Or does it present generally as this is a team member who's struggling? This person, I don't understand why he's so upset about having to work in the isolation room. And the reality is this is a really hard environment for him, let's just say. But I mean, most of us, we're busy, you know what I mean? And we try to pay attention to other people, but we're generally focused on ourselves and what we're doing. And so, yeah, talk to me a little bit about that, about the presentation to management or in the team where you say, okay, how do I recognize when a team member is struggling, say from a conflict with neurodivergence, from sensory input overload, things like that? Or do I just approach this person as an individual who's struggling, and to help me sort of start to put one foot in front of the other to trying to work with this person effectively?
Yeah, I think as a leader, I want to treat the person like a human being, but I want to be aware of the possibility of what they're going through. And so, and the other problem is most people born in, our age group are underdiagnosed. Like I wasn't diagnosed with ADHD until I was in my late 20s. I got an autism diagnosis in my mid 30s. And so I had no clue I had these quote unquote sensory problems until I was more aware and educated myself as to what was going on. So I think that just seeing someone struggling is the leader's job is to like, hey, what's going on? And they may have no clue that it's the parvo dog smell and the block cat smell plus the lighting plus the Kennesaw or whatever the smells that are going on. They just don't have a clue as why they're necessarily overwhelmed. And I think a lot of people can relate to that. Like, I just feel overwhelmed today and I have no idea why. I can do the same job yesterday and be completely fine, but today is overwhelming me and the caseload's not as high. Okay. So that totally makes sense. And also it makes it easier for me to sort of approach people because you just approach them as people and say, okay, I see this person is struggling. Imagine for a sec, Ron, that you were coaching someone who was a manager in a hospital or a veterinarian who was a rule following person. You know what I mean? Who is very much a process person of this is how we do it, and this is how we do it, and this is how we do it, and everyone, you need to get your job done. And again, those people can be really, really valuable in a hospital. I can imagine a situation where people who are process people or rule sort of following people might particularly struggle with working with someone who's neurodiverse and who maybe struggles with this structure or this, just has a hard day for reasons that aren't obvious to someone outside. Coach this manager, this leader for me a little bit to help them get their head into the right place where they can start to, instead of saying, well, she's not following the rules. She didn't do this thing. We had this clearly stated objective and she didn't get to it. How do you start to change that person's mindset? And then how do you help them to be more successful and also be more comfortable? Sure. I think the answer I'll give to anyone is I really feel like we need to go through some neurodiverse sensitivity training. And even if we don't call it that, we need to just be able to understand that everybody's brain chemistry works different. In fact, I would probably say the person who is your, high justice, seeking person is probably on the neurodivergent spectrum themselves, because most autistics need to follow the rules, and neurodivergents as a whole have justice sensitivity, where they have a complete sensitivity to need to follow the rules, need to be fair. We need to have the same setting applied to each person. And it's just not the case. Like, every individual is a person. Every individual has their own strengths and weaknesses, and we just need to treat people like people. And that's what I would probably talk to, this leader or this person who is coming up to me about the need for justice, so to speak. It's be like, I don't treat everybody equally. I treat everybody fairly. And I think that really goes down to what is their strengths? What is their weaknesses? How can I help them? What supports have they already received? What supports can I give them next? What do they think they need versus what do I think they need? And I think there's a lot of questions to answer.
Yeah, I agree with that. So if you're working with someone who's a neurodiverse team member, are there questions that you can ask, Ron, that you think help to open that conversation up? I'm imagining things like, are there days that you have noticed that you particularly struggle? Are there tasks that are, I'm kind of digging at those types of things. I want to ask some open-ended questions to have this person sort of tell me how they're feeling, or what their struggles are, or where they feel like they get lost or bogged down. Because if I don't have that conversation, I don't understand what the challenges are, I can't really support them. And so have you heard questions that help sort of open those conversations up in a non-judgmental way that allows us to support neurodivergent team members?
Yeah, it's hard because, number one, I would say most don't disclose their neurodivergence because of shame of their past, or, shame of, will I even get the job if I do this, or will I get fired if they think I can't do my job? So there's a lot of non-disclosure that happens. And then what I don't want to do is have leaders out in the vet clinics trying to diagnose their
right.
team. Right. And so if we have somebody who has disclosed, then we can start to talk to them about their specifics. What sensory things have you had problems with? What sensory things have you not had problems with? I think we can ask very specific questions once we know there's disclosure. But if not, and we have those who have no idea that they are neurodivergent. And so I think I have to try to go back to treating the person like a person. And you and I have done the whole, let's just sit down and talk and see what's bothering you. I see you're struggling. We go right to the behavior and not the person. This is what I'm seeing. How can we work best together to achieve what it is we're trying to achieve over here?
No, that totally makes sense. Ron, thanks so much for just talking through this with me. I mean, I think you put this in great perspective. This is really helpful. It's not, it's a lot of it's just sort of a mindset change, and a lot of it's just sort of trying to understand and go, oh, well, people's brains work very differently than mine. And we're just going to have to talk to people and try to meet them where they are and figure out, it's not about right or wrong. It's just about different, and sort of come up with a solution that kind of works for everybody. Ron, you're writing a lot on LinkedIn. Is there other places that people can find your work, or should they be following you there?
Yeah, I just started writing on LinkedIn. I've never considered myself a writer. And then I just decided to write an article that I was feeling really passionate about, and it's kind of taken off. And so I will say I'm hopefully going to have a book published in the next year is the timeline, is my SMART goal, so to speak. So maybe we'll have it out by next April is the goal. But yeah, all my writing right now is usually 2 to 5 minute blog articles on LinkedIn.
That's outstanding. Thank you so much for being here, my friend. Guys, thanks for tuning in and listening. Take care of yourselves, everybody.
Yeah.
And that's it, guys. That's what I got for you. I hope you enjoyed it. I hope you took something out of it. Thanks again to Ron for being here. Guys, if you enjoyed the episode, please leave me an honest review wherever you get your podcasts. It means the world to me. It's how people find the show. Anyway, take care of yourselves, everybody. I'll talk to you later. Bye.